of February, Friday. Hope you're all doing well. I forgot to put up my temperature. Well, it's over 40. Folks, the snow's melted in the back of me, so it's melted. This is from 69 that snow, so we thank you for being with us. We're going to visit with Sonny de Rama here. Sonny is the Vice President of Development and Innovation of Healthcare at the VNA Health, and we're going to discuss how the VNA works with seniors. So we're going to bring up Sonny right now. Let's bring Sonny up. Sonny de Rama. Hello, Sonny.
John, how are you? Always a pleasure to be with you. Thank you.
Shucks, Sonny, I forgot to put the thermometer up. We always got to have a temperature,
Okay, I think we're going through a heat wave right now, right?
I think so. My snow in the back should be melted. That's true. And maybe it'll come right back. We don't know. But I think you can look out a window the way you're looking there. You can see whatever it's.
Yeah, I can see some of the snow trying to melt away. So like I said, we're going through a mini heat wave here in Aurora.
Okay, let's welcome Sonny here with our special welcome here. We'll put out our welcome mat. Sonny's been with us many times, and we even had Sonny come up to my Kiwanis group, as my cap says. And Sonny's talked about vaccinations and East Side needing of a vaccination boost. And but today we're going to just discuss early here right now about Sonny's going to give us a little background on the VNA and its work with seniors. Sonny, why don't you just give us a little outline and we can talk a little more about what you were thinking about the VNA and our seniors.
Sure. Yeah, John, thanks again for having me on your show. It's always a pleasure to connect with you and your audience. So, VNA, as you know, has been around for 104 years, and we've really served our communities of all different ages. And I wanted to share with your audience that, we have a lot of services here catering towards our senior population. As you know, we've done a lot of vaccinations here over the last 12 months for those patients that are homebound, whether they're VNA patients or not. But we also have services related to primary care and home care services for our seniors, as well as here at our location in Highland Avenue, we have assistance for those that may need assistance with enrollment and benefits. We have benefit advisors here on staff. So just wanted to share the number of services at the VNA to really help our senior population. We have, of course, the number of health centers in our location that they can utilize for primary care, but we can also bring care to their home. We have our medical house calls program, and of course, we have our home health and hospice services. We were the first Medicare certified home health and hospice agencies in Illinois. This is in the 60s and then again in the 80s. So I think one of the opportunities we have is just want to promote the services with our seniors in our community. Many are not seeking care because they're quarantined. They're trying to avoid COVID, and they've gotten tested, they've gotten vaccinated, they've gotten their booster shots, but they've not really engaged with their physicians because they don't want to go to a medical office or a hospital or, to see their doctor. They're still very, very leery and cautious, rightfully so. So we can bring that care to them. And even if they have a community PCP and they utilize VNA's house calls program, we collaborate with the community PCP so the patient does not have to leave their PCP to join VNA's program. There are many cases when some of the seniors don't have a PCP. So we can also then become that seniors called primary care medical home. So I just want to share with your audience, John, that we have many services here at the VNA. We've seen a steady increase in those age 55 and older to utilize VNA. And we're also doing more work in contracting with many of the Medicare Advantage plans in our service area. So that's something that many seniors, of course, they've worked their entire lives and now have a plan or Medicare Advantage plan through the various health plans in Illinois. And we want to let them know that we're working very diligently to join these network plans so that they can utilize their Medicare Advantage plan to seek services from the VNA, whether it be in one of our health centers or in their own home.
Yes. what would you say your percentage of services to the over 65 is about right now? You got any idea on that number, or that of your participants in the VNA are over 65? Is it a 20, 30, 40%? What, you got any thoughts on that?
No, actually, John, the percentage of folks that we care for at the VNA is just about 5%. And that number has been steadily growing. And this is why I thought, we want to provide care to
You mean the
more.
seniors are 5%? Is that what you're saying?
5% of the care that we provide to our total population is about 5%.
Really? I thought it'd be
So
higher than that.
yeah,
Wow.
no, it's and that's 65. So that's why I think it'd be important to get on your show and also promote the services, because I think many of the seniors don't realize that they can get services from VNA.
No, they probably think it's younger, or maybe a
Absolutely.
mother with a baby, or
Absolutely.
yeah, things like that. Yeah.
Yeah. So we, as you know, we have, we have pediatricians here, so we take care of the babies, and then we have care for the adolescents, the teens, then the younger adults, and then the older adults. But that senior population, as we describe as 65 and older, we've seen a slow but steady increase over the years. But there's still many seniors that I think can receive care from the VNA, and of course they may be receiving care elsewhere. But just want to let the folks know that VNA is here for them. There are services here to help, again, enroll in benefits, receive care in the health center, receive care in the home. So, yeah, we want that 5% to increase, right?
Right.
Because there's a lot of seniors in our community.
Well, we've talked about, Sonny, before with the vaccinations, and we had a Beacon article several months ago now with our friend Heather Wurst about
Yeah.
going in the home on vaccinations, and that type of thing is if your senior. Now, let's just say this could be your mother that you're thinking about your mother to get her some help, or your sister. I mean, the senior, those listening might not be the senior that are listening, but they're family members that could use the services of the VNA, and there's many supporting things that the VNA is doing, and Sonny's bringing it up. Now, I'm going to bring up a phone number here, Sonny. Maybe there's another number that's better, and I'm not saying you. This is the general number, but I want people to really think about if they want to get a setup here of some senior services. Is that a pretty good number there?
Yeah, that's our general number. But if they hit extension 8653, that'll lead your audience and folks in the community, John, to our intake team.
Okay. That's the same number I got at the bottom with the vaccination. So
correct. Yeah. So that number can kind of help our seniors navigate, because those are the folks that are handling our appointments for whether it be vaccinations or care in the home for house calls or home health. So the extension that you have, 8653, is spot on.
Yeah. So if people get involved with that and spread the word around about the VNA and what it's doing for helping our seniors and our loved ones. And Sonny, I want to ask you a little question when I have you there. How's our work? I know Karina, you were working with Karina Suarez Darden on this.
Yes.
She was working on the east side, getting that up. How is that looking? We're still a little low, I'm sure, but are we getting some progress there?
Yeah, so 60505, there has been a steady increase in vaccinations, but we are working with the city of Aurora to host some vaccinations, specifically catering to that 60505 zip code, John. So
Right.
Karina is really spearheading that, working with her contacts in the local community, and we're also working with the city of Aurora with their team that has different programs for seniors to let them know that, hey, VNA is here and these are the services we can assist with. So we have a number of events that we will be partnering with the city. But yeah, we still are focusing on some of these vaccination clinics, especially in that 60505 zip code, because we want to increase those folks that have received vaccinations and, of course, their booster shot.
Yeah, so you seniors out there, or your family member who is a senior, we got to get them vaccinated because statistically, it's those over 65. I forgot the number of cases and deaths from COVID, but it's pretty high, right, Sonny? I forgot
Yeah.
to tell. So
Yeah.
this is a number we want to increase.
Mm-hmm. Yeah. Again, the good news is the state of Illinois, the number of positive tests is going down.
Right.
Folks are getting vaccinated. The hospitalizations are going down, as
Right.
well as the number of deaths. So there's still a lot of work to do, but thankfully the numbers are improving. And I think one of the opportunities in this message I wanted to share with you, John, your audience, is our senior population is still many times quite vulnerable. And this is why, it's important to get vaccinated, but also to receive, primary care.
Oh,
And
definitely.
many of our patients, when you get to a certain age, right, you have multiple chronic conditions that you are dealing with. And I think with home-based services, it can really help alleviate some of that pent-up demand from those folks that have not gone to see their doctor in a medical office. So we can bring that care to them. So yeah, we've done a fantastic job of doing a lot of homebound vaccinations for our seniors over the last 12 months. So, and also doing some of the flu vaccine. And now our goal is help them engage and reconnect with primary care. We can collaborate with their PCP and be an extension of that care in the home. If they don't have a PCP that's senior, we can become their PCP. So there's a lot of different avenues for us to pursue. Bottom line is we want to support the seniors. And again, some people have questions related to their benefits. We have a benefit team here that can help folks maneuver through those questions and challenges. And again, there's no cost for these services that we're offering.
Yeah, I remember a few years ago when I was a little younger, I was got into the affordable health care, and you guys were working as a team to help people with that. I remember,
Correct.
and
Correct.
so VNA's been involved in a lot of things to help people, and seniors right now. I forgot the number of seniors that are diabetic. It's pretty high. Well, I don't know where I got that 25% number. Was that on seniors or general population are diabetic? I forgot, but it's
That's a good
high.
question. Yeah, I don't know. I don't want to give you the wrong
I
information.
understand. I think maybe it was seniors, but
Yeah.
it's pretty high diabetes. So you gotta see a primary doctor here and get involved on that. And I have a friend who's getting up there and is going to be 65 real soon, but that insulin cost is something else too.
Yeah.
Yeah.
Mhm.
And I hope that gets corrected. But we got to get our seniors to get to the doctor. It helps on all these fronts. And so if you do get COVID, it would be minor. If it'll just, you got to get under care of a doctor. And with the VNA coming to you and your loved one, spread the word around and tell everybody that the VNA will help you and your seniors. So I think this is very good, Sonny, that what you're doing there, and your home health care and everything. So let's just keep supporting our seniors by getting them involved. The phone number there is at the bottom, 892-4355, and then extension 8653. So let's do that. And I thank Sonny for just stopping by with me for a little while here this afternoon. And hopefully on Monday we're going to have we'll see, we're working on that guest, but it's always something else working on the guest. But we're working for Monday at 5. So again, Sonny, thank you for coming by today and just visiting and giving us an update on how we can help our seniors with the VNA, and it's really appreciated. So again, thank you, Sonny.
You're welcome, John. Yeah, please visit our site, vnahealth.com. We also have nutrition classes for our seniors. They can do a Zoom call, healthy eating, dieting, nutrition. So yeah, visit our website, please. And then John, always appreciate your support for the VNA Healthcare. We appreciate all you do.
Thank you very much, Sonny. So remember all those things, you folks, your seniors, your loved ones who are seniors, tell them about the VNA. Just tell everybody about the VNA and how they're supporting seniors. And let's just keep up the good work here. And that snow is really going to be gone in the back. I'm sorry about that, folks. I'm still, I love a little winter, but it's going, I think.
Yeah.
So again, thanks, Sonny de Rama of the VNA. Thank you very much for visiting with me this afternoon. And we'll see you Monday, Lord willing. So for right now, God bless everybody out there, and bye-bye. Bye-bye now.
Thanks, John.